Stroke is a very dangerous condition. You would have heard about stroke, which is a sudden problem in the blood circulation in the brain. It will be of two types. One kind of stroke, which you would have commonly seen and quite common in 70% of the cases, is because of obstruction to the blood supply of the brain. It's called ischemic stroke. In another 30% of cases, it will be because of bleeding in the brain. It's called hemorrhagic stroke. So these are a different kind of condition in which the most common cause, one of the most common cause, is because of a rupture of aneurysm. Aneurysm is a ballooning out of the blood vessel of the brain. So this ballooning abnormal blood vessels will suddenly rupture. Because there will be sudden bleeding, what happens is patient will experience an excruciating headache, the worst headache of his life. He will have a sudden onset headache, and most of the time they will become unconscious. Sometimes they may have a seizure, they may become unconscious. In that, many people will lose their life also, not even knowing whether it is related to heart or brain. Lucky people, if the blood clot just stops temporarily, they will have time to reach the hospital. And once they reach the hospital, we do an imaging modality called DSA, digital subtraction angiogram. In that, we will see the reason and the location of where this balloon has burst. Once we locate it, we need to secure it so that it won't bleed again, because if it opens again, he won't be lucky as the first time. It's a very dangerous condition. It requires treatment at the earliest. And once noticed where it is located, the treatment options are either to do what is called a coiling, that is without opening, to get through the blood vessels and block that ballooned out blood vessel. And this coiling won't be suitable in all the cases. So in certain cases, we need to open up the skull. That's a micro neurosurgical procedure. Under the microscope, we will locate this aneurysm and clip it so that that won't leak again. When he passes through these stages of ICU stay and proper clipping, most of the time they will get back to their regular lives and can be as healthy as earlier.